This is Dr. Vaishali, and I'm reading from the book Substance of Homeopathy, book written by Dr. Rajan Sankaran, chapter number 51, State and Pathology. I heard from my friend Dr. Anton Rohrer from Australia about the case presented in conference in Vienna. He explained that senior homeopath Dr. Dario Spinardi brought a case of patient who had a tumor on the face. The remedy given to him was sulfur. The man also had itching eruption between the fingers. The tumor became less, but this nature become worse, and so more angry, more temper, in spite of becoming worse in the psyche. The tumor reduced in size. After 3 years of treatment, the psyche improved too. I have observed in practice that some patients have a very intense state or the state of the disease, but very little pathology. For example, we may have a child with the intense characteristic of the Calica carbonica, with the fear, sweat, craving for eggs, etc., but with very little or no pathology. On the other hand, I have also seen the patient who have a very mild state of the disease but have a severe pathology. I ask myself what influenced the development of pathology in person with a state of disease. At this point, I was approached by a union leader. He had come to me for treatment of the skin condition, an eczema. This man is full of guts. You see nothing special about him, but this man has single-handed fought everyone up to the highest authority. Many people have tried to crush him, but he would not be crushed. When his demands are rejected, he goes on strike and his co-workers join him. He has that leadership. His agitations initially produced little effect, but he persistently intensified the struggle. He is a fighter and loved to fight. When I asked him for the modalities of the eczema, and he said, "The eczema harassed me. I have the scratch violently, but I have not have noticed that whenever I am at the height of the agitations, the eczema almost completely disappear. The moment there is a peace, my skin start itching again, and the eczema flare up." Here I could see a various obvious connection between the situation and the pathology. In his mind, the feeling is that patients are or people are unjust, that they harass him and that he must struggle even violently in order to survive. With his state of being within him, he tried to find out match it outside in the life, and so he took for such a situation, and when he finds one, he goes into the intense violent struggle. He find the situation of his internal delusion, and then his pathology disappear. When there is no such situation outside of his life, and he is unable to live his internal delusion, means being harassed, and there is no way in which he can fully express his state, and this is the time when he develop on his body an eczema that harass him, because of which he has to have a violent struggle. This led me to the idea that pathology develops when a person is unable to find the outside himself the situations of his internal delusion. Since he cannot find the situation outside, he cannot react to the outside. So, therefore, he develops such a situation in his own body in the form of pathology. To understand this concept, I shall give a rather crude example. A man may have a delusion that there is a fire everywhere. He may have an internal desire to run away, to escape, or to pour water over it. In his everyday life, he may be an accountant, and now where he can find a situation which require a reaction from him, and as if there were a fire all around. So he has to suppress his delusion at a conscious level, but this suppressed delusion has to express itself somewhere. So, this man, in my experience, is likely to develop a severe bout of burning in the epigastrium or the palpitation, etc., where he develop a similar panic and has to run about here and there or pour into himself large quantity of water as if to put out the fire. So, if the internal delusion cannot be expressed because the external situation is not conductive, Or in other words, when a man cannot find an external situation where he can fully live his delusion, he will develop or need to develop a pathology. If he can find the situation where his internal feeling can be fully expressed, he need not develop the pathology. It is not necessary, not required anymore. In our life, we try to find the situation of our delusion, and if we succeed in this situation, we feel most comfortable as we are able to express fully our internal state. This is often possible in the childhood. For example, Platina child can say, I am a queen of the house, and the parents will agree. There will be no obstruction, no contradiction. When the child grows up, she will try to find the situation where she can be queen. But this is not possible always, and she can only find a situation much less than that of the queen. The rest of the delusion has to be suppressed, and this will manifest in the form of pathology. When this woman finds a situation where she can be queen, this pathology can and very often will reverse itself. In life, we try to find a situation close to our delusion. We have a choice in three spheres. It is a vocation, location, and relationship. In each of these, we try to find out where our internal delusion can be lived. But our choices are limited, and we force to choose one where the possibility to live or express the delusion is limited. To the extent we suppress it, and it manifests in the form of pathology. For example, let us take the case of person who has an internal state of aurum metallicum. The inner feeling of this person is that he should a heavy responsibility. He has to struggle desperately to carry out, do his duty, live up to the social and other expectations on him. This person in his childhood fantasizes about his future task, his future life, and can live with the delusion that he is meant for the great task, for great responsibility. When he grows older, he tries to actualize this fantasy. If he can find the opportunity to do so, he will be a large extent free of pathology, but often he cannot find a compatible situation. He cannot find an opportunity to responsible for others as his internal delusion. To realize the full load of his delusion, he now develop a ischemic heart diseases or such a pathology, so that even a everyday life become a great struggle. Even a small responsibility seems too much. Now, through the pathology, he can actualize his delusion. Thus, in my view, pathology is often the result of a difference between outer and inner realities. An exciting factor stimulates the delusion. The state is aggravated, but outer reality often does not allow the expression of the delusion. Then the aggravated part of the state has to be suppressed. Pathology results, and thus the beginning of the pathology can be traced back to the exciting factor. And an example will make this clear to you. In case 1, I gave in the spirit of homeopathy the case of the 35-year-old married woman, a housewife, who developed the arthritic problem after the death of the neighbor. This neighbor happened to be the only woman in her building who shared her mother tongue. Uh, See in the chapter 33, Spirit of Homeopathy. This patient did not well on Barata carbonica. Did well on the Barata carbonica, sorry. She was a very shy and timid woman who always felt the need for support, a crutch, which this neighbor provided. On the death of the neighbor, she lost her crutch. This excited her anxiety, and thus her Brata carbonica state, but but the state could not be expressed. She could not longer actualize the delusion that her legs are cut off, like a Brata carbonica delusion, since in reality she was an adult and fully capable of standing on her own feet. She developed a crippled arthritis that naturally made her lean on others for the support, and thus, through pathology, express her state that her legs are cut off. In this case example, we can see whole process of the development of pathology quite clearly. like having a state with the delusion that she is crippled and needs support. She looks around to see where she can find a person who would complement her state, and or in other words support her like a child or a cripple, and thus help her leave the delusion. On finding such a relationship with her neighbor friends, this woman remained free of the pathology. The loss of this friend excited her insecurity. Now the situation is different. Her relationship is gone, the delusion cannot be actualized, and it has to be suppressed, and it manifests in the form of the pathology, which is an indirect way of the actualizing the delusion, expression of the delusion in the form of disease. Case number 2. Let us look at another case given in the spirit of homeopathy. I refer to the first case from the chapter 25. Here the man developed the pathology after he was given a responsibility that he was not used to. This man is very conscientious person and has a high sense of responsibility and the duty. He was managing well till he was given an unusual responsibility. This excited his aurum state, and but the responsibility that took on was not as heavy as his state perceived it to be, and he developed a cardiac pathology, and it's difficult for man to withstand stress and responsibility. In this example, we find a person who has coped up with his intense state, has made a balance with the surrounding. When an additional factor comes up, this state is intensified, but the situation outside is not an, as intense as he perceived it to be a delusion. Case number 3. To take another example, consider the case of the cop-up of lycopodium patient. He could be a lawyer, needs to speak in public, and thus leave his delusion that he has to be performer, a public speaker, in order to survive. He has the fear that he may not be able to perform well, but this fear is now very much in the background since he is very much used for the performance used to the performance, sorry. Then sometime in his life there comes a very difficult case, a complicated case with every chance of failure. His inner fear of not being able to succeed is much excited, and this fuel his delusion, and that if he does not succeed in this case, he finished and his career will be destroyed, his life will be ruined. This is not reality. A failure in this case would not, and in reality means as much as he feels it does. Also, even his fear not being able to perform is not based on the reality. The difference between his perception and reality will now have to be made up for by the pathology. And developing such a pathology, a hamper performance and public speaking, he could develop a rheumatic or gouty attack, hoarseness of the voice, or a severe abdominal colic, liver intense fever and liver pathology, intense headache, anything that can affect his performance. Here we see how a person selects such a vocation as to actualize or realize his delusion. If his delusion is that he needs to be public speaker, he would choose an occupation that has in it the need for public speaking, and this can be also be seen in the way a person choose his friends or spouse. Especially in the case of his life partner, he would choose spouse who help him to live his delusion. For example, lycopodium person would choose a spouse who demand performance, or friends who would look up to him only if he is good performer. An aurum metallicum person would have friends who would make him responsible for them, and so on. In this way, these people are able to live their delusion and thus avoid the need for the pathology. Again, as in the previous example, when they came across a relationship that is too demanding, the state is intensified and pathology can result. Some people, however, are unable to find an occupation or the relationship in which they can actualize their delusion. Such persons have to find some other means of the doing so. The commonest way of doing it is in some form of recreation. Taking up a hobby. Hobbies are chosen in such a way as to recreate inner delusion. For example, person may have the delusion that he has to face risk and danger successfully in order to survive. He may choose an occupation like business where there is a lot of risk involved, and but gradually as time goes by his business gets more and more stable and the risk element gets less and less. Then the person feels as an internal restlessness and starts looking around for the hobby which involve the facing risk and danger. He may choose to go on a risky journey, or he may choose rock climbing, or even a bungee jumping. In the latter example, the inner reality of the person may be tremendous need to face a high place and water and danger. When we examine the interest and hobby of the people, we see in it an attempt to recreate the inner reality. This holds true for the movies and television. The kind of movies that are popular represent the inner reality of the large percentage of the people. For example, the kind of movies that are getting popular these days are one with an emphasis on violence, cruelty, crude sexuality, etc. This shows the inner reality of this age, which has in it the need for this quality. Social restriction make expression of these qualities difficult, and therefore these are the very qualities that are suppressed and hence find the expression through the cinemas. On television, the soap opera and getting increasing popular. So the reason could be the unlike in the movie where you can live a fantasy world for the couple of the hours in the soap opera, one can identify with one of the character is close to their delusion and live that person's life for a year. The life that you could not live yourself, you live vicariously. Uh, Yes, you live vicariously, right? And people live the lives of other people through the story. In soap opera, the character usually represent the big remedies in homeopathy, the polychrist. Thus, many people can live through them and to an external avoid the need for the pathology. Thus we can see that the things get popular for the reason. Things get popular because they are needed. Also it can be seen that the person who fully lived his delusion through his vocation and relationship does not have much interest and movie which is more expressed in a movie and television, especially of a specific type of movie. So person choose the movie and shows which represent their delusion. This means of entertainment are called recreation. I believe this is very meaningful word because these are the means to recreate his inner reality. For example, under the heading interest and hobby in chapter 33 on the spirit of homeopathy, I have given a case where the boy who was helped with the anacardium had a tremendous interest in watching the horror movies, especially one which involved a lot of cruelty. I believe that it is possible that if such movies are banned, then person who are in that state would either start more actively finding avenue to the cruel or world suppressed and would suppress this state and create a horrible pathology. At a given time, the person's delusion is expressed in three distinct parts. One, the conscious part which can be felt and expressed in word and action. Number two, subconscious part which is expressed especially in the dreams. And number three, the pathology which is the crystallization of the delusion. This brings us the understanding of the second part, the dream. This lies in the between the conscious part of the delusion and the pathology. The dream are also the body's way of actualizing one's delusion. When a person's situations does not allow such an actualization, it is a false expression into the dreams. Together, the conscious part and the subconscious part of the delusion represent the non-fixed aspect of the delusion. They represent the state, whereas pathology represents the fixed part of the delusion. Since we treat state of being and not the pathology, and since the potency is selected on the intensity of the disease state. The potency is to be selected in a proportion to the sum of the conscious and subconscious part. When we give such a potency, it removes the disease to the extent, and this creates a void where the part that has been suppressed into the pathology can come back into the central state, and thus the pathology gets better while the central state apparently seems to remain the same. So the remedy needs repeating, and as long as the patient feels better, you do not need to repeat. But when he start feels tense again, you need to repeat. You give one dose and the patient feels better mentally and generally, or his physical are better, but he feels tense. The Letter 2, it is good reaction to the remedy. For example, a patient has a pathology but no dreams. The pathology gets better with the medicine, but he now start having bad dreams, which shows the situation. His sleep is disturbed and he is restless. The pathology has improved, but the mental state is worse. This is when the remedy needs repeating. You have to keep repeating as long as the central state remain of the same intensity, and after some time, maybe a year or two, in the chronic cases, as the person get healthier, the amount of central disturbance that he can stand increase, and so more is diverted from the pathology to the central disturbance. And before the person can push it down again, you have to repeat the remedy higher. When the central delusion is bigger, then the repetition is higher. This is not a license to repeat the remedy frequently. We have to understand what we are treating. We are treating the central disturbance. If there is a relief in the pathology but the central disturbance is coming back, this is the time to repeat the medicine and repeat higher if needed. The nature of the pathology will indicate that was the suppressed, and it indicate the central disturbance as much as anything else. What you have to ignore is the diagnostic label, the name. The way it manifests is crystallization of the central disturbance. What is the characteristic location of each remedy? Which is the part that is affected? Argentum metallicum is the performer and the throat is affected. His inner delusion is I may not be able to perform. I cannot speak, my voice may fail, and each remedy has a characteristic location. This can be found in the Boger's synoptic key at the beginning of each remedy. What determines this specific location? This can be seen in the example of Argentum metallicum. In this remedy, as we have seen previously, performance, especially shows and use of the voice, are the condition for feeling okay. In such a person, if he had to actualize his delusion, he cannot perform when needed. Then the organ of the voice, means larynx, should be affected. Similarly, similarly in other remedies, we can see that those organ will be chiefly affected, such as can actualize the delusion.